everyone, I'm Kiara Malazi, and today we're going to be discussing endometriosis. Why is a disease that so commonly impacts women always diagnosed later in life, with numerous patients struggling with symptoms that they cannot even connect to endometriosis? Despite this still being an issue in the present, there has been some progress in the discovery of new treatments and the ability of a faster diagnosis. Today, I will be talking about what exactly is endometriosis, how it is connected to genetics, and finally, what new discoveries and studies have been done that have led to more advancements. So, what is endometriosis? We've probably all heard this word before, but it is also likely that not a lot of people actually understand what it is or how it works. Endometriosis is one of the most common gynecological benign diseases. It occurs when there is growth of tissue similar to the endometrial lining of the uterus outside of the uterine cavity. When I first heard this, it sounded very confusing, but in simpler terms, it happens when tissue that looks and acts like the lining of the uterus grows outside of the uterus. Some common places where it can grow include the space behind the uterus, the myometrium, the ovaries, the fallopian tubes, and more. In addition, some symptoms can include chronic pain, often worse during periods, excessive bleeding, infertility, and more. Nonetheless, countless of women do not realize they have it, as it is common for women to feel pain during their menstrual cycle, which leads to these symptoms being often overlooked. Now that we understand what this condition entails, we can delve into the role genetics plays in it. It is a known fact that it has a strong genetic component, and through numerous studies, it was found that this disease has a familial element. For instance, a study conducted by J.L. Simpson with 123 individuals with endometriosis concluded that relatives of women affected are 5 to 7 times more likely to have this condition. Furthermore, a method that has been used to investigate gene mutation associations with the disease involves gene mapping, which most of us are already familiar with. It includes candidate gene studies, linkage mapping, or genome-wide association studies, which have been able to determine variants associated with the disease. Through this method, it has been found that genes such as WNT4 and VEZT contribute the most consistently associated genes with endometriosis. Now, it is crucial to discuss new discoveries that have led to advancements in the past few years. An important study conducted in 2025 includes a genetic association between endometriosis and immunological diseases. A trend was found in which most endometriosis patients showed significantly increased risks of autoimmune or autoinflammatory diseases, including osteoarthritis, multiple sclerosis, arthritis, and more. Researchers focused on genetic associations, and one of the many things found in this study includes that a total of 12 genome-wide significant lead NSPs for these diseases were mapped with 1 megabase of endometriosis genome, with 4 of them tagging to the same genetic signal. This shows that endometriosis and these conditions likely share some of the same underlying genetic risk factors and biological pathways. Overall, the results in this study showed that females with endometriosis are at an increased risk of both autoimmune and autoinflammatory conditions, with 42% and 28% respectively. Getting these results and doing more research on this matter is crucial, as the early detection of immunological conditions in individuals with endometriosis could improve patient outcomes. Researchers at the University of Oxford and 25 teams across the world now have the largest published study to date in regards to the genetic basis of it. This study includes DNA from 60,600 women with endometriosis and around 700,000 without. Through this research, it has been found that there are 42 areas across the genome that harbor variants that increase risk, as well as alterations in the expression of the endometriosis genes. By linking these variants to profiles of molecules in the endometrium and blood, they identified a range of genes that were differently expressed in these tissues and therefore had a likely role in the disease development. These genes can also be used to determine different types of endometriosis. Therefore, what this study accomplished is not only the start of new solutions for faster diagnosis, but also treatments for specific types of endometriosis, which is great progress considering the notable lack of research and treatment throughout the years in regards to this disease. Today, we have not only understood what endometriosis is and how it has been diagnosed throughout the years, but we also have understood the importance of these studies and new research. Women all over the world are still struggling with this condition, not knowing if they have it and not having the resources to treat it. Focusing on the creation of better and more accessible treatments or on the better understanding of the causes and effects of endometriosis Millions of women today and in the future generations will feel the positive effects of taking endometriosis seriously, not brushing off women's symptoms and actually prioritizing patients' health and quality of life. Thank you.